Now let me talk about the state of the pandemic. At the briefing last week, I mentioned 3 uncertainties that we are dealing with. Number 1, which is the trajectory of the daily infection cases. Number 2, the number of patients who are severely ill and require ICU care. And number 3, whether our hospital system becomes overburdened, whether it's able to cope. So start with the first uncertainty, the trajectory of daily cases. It is now on its 4th doubling cycle, 100 to 200, 2 to 4, 4 to 8, and now 8 to 1,006. 4th doubling cycle. If you track this 4th cycle, at its fastest, local community cases, excluding the dormitory cases, they were doubling 6-7 days. It is slightly longer now, so there are some signs of a slower rate of increase. Be very clear, cases are not declining. We are just observing that now the pace of increase, there's a slight slowing, but it's very early days. We are all hoping and working towards this trend continuing, and for daily infections to eventually turn the corner. As of now, it is still increasing, and each daily jump is a big absolute number and adds pressure on our healthcare system. So how the trajectory will turn out in the coming weeks is a key uncertainty, remains one. Last week I cited it as one, this week continues to be one. So looking at the momentum, it will cross 1,600 cases a day and proceed to its next doubling cycle to 3,002. Whether it completes, we don't know. Whether it gallops there or whether it slows down and reaches there slowly, this is something we need to observe. What we do know is that no transmission wave lasts forever. At the current 1,600 cases a day, it translates to about 26 cases per 100,000 population per day, 26. So it is lower than what is experienced in UK and US now. They are about 40 to 50, but higher than many other European countries that have reached an equilibrium, such as Germany, France, Italy, Spain. They are about 7 to 10. Yeah. So this is possible reference point for us. If we carefully chart our way forward in this transition journey, we are likely, in fact, I think we will see cases continuing to rise. At some point, it will turn before coming down and stabilizing at a level that represents a new equilibrium. And at that point, we will emerge much more resilient. And this is what we are working towards. The second uncertainty, the number of patients who fall seriously ill or die, it is rising in tandem with daily infections, but at a much lower level. And this is due to the protective effect of vaccinations. So, as Min Gan said, they account for a small proportion, 0.3% of total number of people infected. This would not be possible without our massive national vaccination program. So we continue to see a much higher incidence rate of severe illnesses and deaths amongst unvaccinated elderly individuals. As of yesterday evening, we have 23 ICU beds occupied. And as I mentioned earlier, we are able to stand up almost 300 ICU beds at short notice, which means as of now, the situation remains stable, but we need to watch it very closely. ICU numbers lag infection numbers by 10 days, 14 days, so we will expect ICU numbers to rise in the coming days, and some of them, especially if they are unvaccinated, elderly, or with underlying illnesses, will unfortunately succumb. DMS, Kenneth Mark, will speak more about this later. The final uncertainty, whether our healthcare system will be overburdened. And this is the most immediate concern now. Remember, we mapped out a 4-stage transition process. Preparatory stage, then transition stage A, then stage B, and finally an endemic stage. So on 19th August 2021, after over 75% of our population were fully vaccinated, we announced that we enter the preparatory stage. And we started to implement a ramp-up plan to expand our capacity to cope with higher number of cases when we have to go into the later transition stages. And we also, at the same time, started adjusting our healthcare protocols, if you remember. At the preparatory stage, which is now where we are, we still have many safe management measures in place. There's a mask requirement, group sizes of 5 to go to a restaurant. You must all be vaccinated. Hawker centers, no vaccination requirement, but limit to 2. Event size cap, so on and so forth. But despite this, Delta variant doesn't follow our script. So it transmitted through the community and is driving up daily cases much more quickly than we expected. Before our ramp-up plans are fully implemented and before our support systems are fully in place. But nevertheless, this is the nature of the virus that we have to deal with. It is what every country has to contend with, and the inevitable path forward if we want to live with COVID-19 and regain our normal lives. So we need to ride out this wave of transmission as best and as safely as we can. The exponential rise in infections over this very short period of time during the preparatory phase has put our healthcare system under a lot of pressure. Our healthcare workers are stressed, but I'm very grateful for their very high level of dedication to care and to serve their patients. And they are holding up, they are doing their best to cope with the situation. So as a community, we should give them our full support during this period and for doing their job so professionally and with so much commitment and dedication. At the same time, we are going to accelerate the implementation of our ramp-up plan. This includes the following. First, increasing the number of COVID-19 hospital beds from 1,000 to 1,006. This is done. But it comes at the expense of some degradation of normal services. So some electives, you'll find that we have to postpone them. Second, protecting our people and resources, which is why we announced, MOH, we announced that hospitals are not allowing visitors for 4 weeks. So this minimized the chance of the outbreak of a big cluster in any of our wards. Third, stepping up our CCF, community care facilities, by over 1,000 beds from 3,005 to about 4,600. And this will be done by end of this week. We are able to stand up 1,000 beds because we planned for this when we entered the preparatory phase. So this can be done right now. Fourth, commissioning a new class of facility. Initially, we call it stepped-up CCFs. They are better resourced and better equipped for closer monitoring and management of patients with chronic illnesses. So in fact, after reviewing, we find that they are actually closer to hospital beds than CCFs. And so we have renamed them and called them CTFs, Community Treatment Facilities. We have commissioned about 300 CTF beds this week. First one opened today. And planning to open another 700 beds at Changi Expo and another 200 at Sengkang Hospital. And this will be done in the next couple of weeks. We are seeking help from private sector hospitals as well as the SAF to operate these CTFs. Most importantly, expanding the home recovery program that I spoke about earlier. Today, over 40% of daily cases go on home recovery, and the proportion is rising. And without that, without the home recovery program, the system would have been overwhelmed already. So it is important that we get it right and give everyone on the HRP their proper medical support. CTFs and home recovery are new care models, and DMS will speak more about them later. In addition, we have a good start to our vaccine booster program. It will add a further layer of protection, especially to our seniors. By the end of today, we would have invited about 605,000 seniors above the age of 60 to book their appointments. The uptake has been good and encouraging. So, for example, the first batch of invitations we sent out, almost 70%, and in fact 70%, have taken their injections or booked their appointments. So across all batches of invites, over half has done so, and the numbers are rising. So thank you for that, and I think please come forward, take your jabs and take your boosters. When most have booked their appointments and we know that the crowd is sufficiently spread out, we will open our vaccination centers for walk-ins. As mentioned by Min Gan, the EC19V has also reviewed international and local data on the safety and efficacy of boosters for those in the 50 to 59 age range, and has recommended their inclusion in the booster program. MOH agrees with their recommendations, and you will be invited to take your booster shots via SMS next week. With all the above efforts, I believe we can cope with 2,000 to 2,500 cases a day. It will be quite stretched, I must say. So I hope it will be a temporary basis before cases drop, rather than on a sustained basis. However, we will bound to cross 1,600 cases a day, and if daily cases continue to rise exponentially, we may see a fifth doubling cycle to 3,200 cases a day within the next 10 days or 2 weeks. So when I mentioned in an earlier press conference that cases might go through 5 doubling cycles to 3,200, it was not an exaggeration. Will it happen? We don't know for sure, but it is possible, and we better be prepared for it if we want to ride this wave successfully to emerge as a more COVID-19 resilient nation on the other side. So there are 3 things we need to do. First, even as we prepare ourselves with all the things I said we were doing to handle 2,500 to 3,000 cases a day, we will start activating the plans to be ready to handle 5,000 cases a day. Second, we will need to tap on the brakes to slow down the increase in cases, to spread it out over a longer period of time, rather than a sudden sharp increase that we don't get overrun by the virus. This phrase that I just said, slow down the increase in cases, spread it out over a longer period of time, it is added in by one of our medical experts in MOH. It's quite a profound statement. Maybe I try to explain it a little bit. We spread the cases over a period of time because there is quite a good basis to believe that you want to be resilient to COVID-19, there must be enough antibodies in the society, which means the number of infections actually can't change very much. But you don't want it to happen within a short period of time with a high peak that make our system overburdened and unable to cope. But by tapping on the brakes, you spread it over a longer period of time, still the same number of infections, but we can cope with it. Third thing we must do, and most importantly, each of us need to take care of ourselves and others around us. Get your booster or vaccination if you are an elderly, to get tested and stay home if you are unwell, continue home recovery if you are fully vaccinated and infected. And do cut down on our social activities to do our part to alleviate the pressure on our healthcare system and our healthcare workers. I want to end by reiterating what Minister Gan has just said, which is that we are staying on course to transit to a COVID-19 resilient nation. It is the only way for us to recover from COVID-19 as a people, as a nation. But along the way, we need to adapt and adjust our plans depending on what Delta variant throw at us. We may seem like we are trailing some European countries which are or have reopened and living lives quite normally. But remember, they paid a huge price in human lives, mostly last year, which we will do whatever we can to minimize, which is why we are opening up only after we have vaccinated the vast majority of our population. So we will ride out this wave differently, safely, and successfully.